Hello, I'm Dr. Victoria Brooks. Every day, I share real effective ways to help men restore their strength and confidence. Make sure to subscribe so you don't miss out. Let's get started. Today, we're diving into something that most men have never been told, yet it's completely within your control. I'm talking about your vascular health, specifically how to dramatically improve blood flow throughout your body, including to the areas that define male performance and vitality, in just 5 minutes a day. Now, I know that sounds like a bold claim, but the science behind what I'm about to share is undeniable. This isn't hype. When you understand how circulation really works and what silently restricts it as you age, you can use a few powerful evidence-based techniques to literally reset your vascular system. You'll open up pathways that may have been partially closed for years without you ever noticing. Most men think that poor circulation is just something that comes with age, but that's not true. Your blood vessels are not rigid pipes. They're living, flexible tissues that respond to your environment, your breathing, your posture, your stress levels, even your thoughts. Inside every artery and capillary are smooth muscle fibers that can either tighten and restrict flow or relax and open wide to deliver oxygen-rich blood to your muscles, brain, and reproductive organs. Here's the truth most men don't realize. Past the age of 40, the majority are walking around with chronically constricted blood vessels. Not enough to cause a medical emergency, but enough to limit function, especially in the smaller, more delicate vessels of the pelvis. That's why you might feel slower recovery, lower energy, or reduced responsiveness even if you're healthy. But there's good news. You can reverse that constriction almost immediately. You can retrain your vascular system to work like it did when you were in your 20s, and it takes only 5 minutes. To understand how, we need to talk about one of the most powerful molecules in your body, nitric oxide. It's produced by the inner lining of your blood vessels, the endothelium, and it acts as your body's natural vasodilator. When nitric oxide is released, your arteries relax and widen. Blood flow increases. Nutrients and oxygen reach your cells more efficiently. The result? Better performance, stronger vitality, sharper focus, and a real sense of energy and youthfulness. The problem is that as men age, nitric oxide production declines. The endothelium becomes less active and less responsive. But here's what the latest research shows. Endothelial function can be rapidly restored, not with medication, but through specific breathing patterns, muscle contractions, and movements that trigger nitric oxide release naturally. That's what this 5-minute vascular activation protocol does. It combines 3 scientifically validated mechanisms. First, it stimulates nitric oxide production through rhythmic breathing and vibration. Second, it enhances blood flow through isometric contractions that create a controlled surge of circulation. And third, it uses gentle, dynamic movements to mechanically pump blood through the pelvis and abdomen while calming the nervous system. When done together, these 3 elements produce an immediate boost in circulation and, over time, retrain your vascular system to stay open, flexible, and responsive. Let's start with the first part, the breathing technique. This isn't just deep breathing. It's a precise rhythm that activates your parasympathetic nervous system, the part responsible for rest, recovery, and blood flow. Here's how you do it. Inhale slowly through your nose for 4 seconds. As you breathe in, expand your belly first, then your chest. This diaphragmatic pattern signals your vagus nerve, the body's master switch for relaxation and circulation. Next, hold your breath for 7 seconds. During this hold, begin to hum gently in your throat. The humming vibration stimulates nitric oxide release in your sinuses and nasal passages. Research shows it can increase nitric oxide levels up to 15 times compared to silent breathing. Then, exhale through your mouth for 8 seconds, making a soft whooshing sound. The long exhale deepens parasympathetic activation and lowers vascular tension. That's one cycle. Repeated 5 times. The entire breathing phase takes about a minute and a half and instantly primes your vascular system for expansion. Now, let's move to the second component, isometric contraction. Isometrics are exercises where you tense a muscle without moving it. This temporary tension restricts blood flow to that muscle, and when you release, the blood rushes back with greater force, a phenomenon known as reactive hyperemia. This creates a powerful wave of circulation through the entire lower body. We'll target 3 muscle groups: the glutes, inner thighs, and lower abdominals. Start by squeezing your glutes together as hard as possible. Imagine trying to hold a coin between them. Hold for 15 seconds while breathing normally. Then release suddenly. You'll feel a warm rush of blood flow. Next, press your knees together tightly, as if you're squeezing something between your thighs. Again, hold for 15 seconds, breathing normally, then release. Finally, tighten your lower abdomen. Pull your belly button toward your spine and hold the tension for 15 seconds. Release fully. These 3 contractions take about 90 seconds total and send a surge of oxygenated blood through your pelvis, abdomen, and lower body. The third component is movement, gentle, rhythmic motions that create pressure changes inside your abdomen and pelvis, massaging your internal blood vessels and improving nerve function. Start with pelvic tilts. Stand with your feet shoulder-width apart, knees slightly bent. Tilt your hips forward, arching your lower back, then tilt backward, tucking your pelvis under. Move smoothly between these 2 positions for 10 cycles. Next, place your hands on your hips and draw slow, wide circles with your pelvis. 5 in one direction, 5 in the other. This loosens the muscles around your hips and lower back, which can otherwise compress blood flow. Finish with 5 controlled squats. Lower yourself as if sitting into a chair. Pause at the bottom for 3 seconds, then rise back up. These squats create pressure and release cycles that push fresh blood through the pelvic region. Altogether, these movements take another 90 seconds. The final 30 seconds of the protocol are dedicated to vascular visualization. This might sound abstract, but studies using thermographic imaging show that focused mental imagery can influence real blood flow. So close your eyes, take a deep breath, and imagine warm, oxygen-rich blood flowing easily through every vessel in your body. Visualize that warmth concentrating in your lower abdomen and pelvis. Picture your blood vessels open, smooth, and vibrant. That's it. 5 minutes. You've just trained your vascular system and likely increased nitric oxide production, circulation, and nervous system balance. Now, how often should you do it? For immediate results, perform the protocol 15 to 30 minutes before you need optimal function or performance. The circulation boost can last for several hours. For long-term benefits, practice it daily, ideally in the morning before breakfast. Consistency trains your blood vessels to stay open and responsive. Within 2 to 3 weeks, most men report feeling noticeably warmer, more energetic, and more responsive overall. You can also repeat it during the day whenever you need a mental or physical recharge. There's no risk in improving circulation, only benefits. Let's discuss a few ways to make this even more powerful. The first is temperature contrast. After completing your 5-minute routine, alternating warm and cool water on your lower body, for instance, in the shower, trains your blood vessels to expand and contract dynamically. Warm water causes dilation. Cool water triggers constriction, and switching between them strengthens vascular responsiveness. Another enhancer is targeted pressure. In traditional medicine, pressing specific points near the inner ankle and lower abdomen is believed to stimulate pelvic blood flow. applying gentle, sustained pressure to these areas for 30 seconds to a minute after your protocol can deepen the effects. Body position also matters. Doing the breathing and contraction phases while lying on your back with your hips elevated allows gravity to assist blood flow to your pelvis. You can then do the movement phase standing for full muscle engagement. Hydration is another overlooked key. Blood is mostly water. When you're dehydrated, it thickens and moves sluggishly. Always drink a full glass of water 30 minutes before doing the protocol to maximize flow and nitric oxide efficiency. Timing your meals is equally important. Performing this protocol on an empty stomach, or at least 2 hours after eating, prevents digestive blood diversion. Right after a large meal, much of your circulation is focused on digestion. That's blood not available elsewhere. Now, let's touch on something few people connect with blood flow: stress. Chronic stress keeps your sympathetic nervous system active, the fight or flight mode, which constricts blood vessels. Over time, this constant tension starves tissues of oxygen and creates fatigue, poor recovery, and reduced performance. The breathing component of this protocol is one of the most effective ways to reset your nervous system. Even if you don't have 5 minutes, just practicing the 4-7-8 breathing pattern for 1 or 2 cycles during your day can lower stress hormones and improve baseline circulation. Here's what to expect as you continue. Within the first week, you may feel a sense of warmth in your hands, feet, and lower body. That's improved blood flow. By the second or third week, you might notice stronger morning responses, better energy throughout the day, and quicker recovery after activity. By the 4th to 6th week, many men report their baseline function feels like it's been recalibrated, more consistent, more reliable, more youthful. The beauty of this system is that it's completely natural. No pills, no supplements, no equipment. Just 5 minutes of targeted breathing, muscle activation, and movement that trains your vascular system the way nature intended. Remember, vascular health isn't fixed. It's trainable. Every time you use this protocol, you're strengthening your endothelium, improving nitric oxide production, and teaching your body how to deliver blood more efficiently. So start today. Make it part of your morning routine, or use it as a quick recharge during the day. You'll not only feel the difference, you'll see it in your energy, focus, and confidence. If you found this helpful, make sure to subscribe and turn on notifications so you don't miss future episodes where we go even deeper into optimizing men's vitality, energy, and long-term health. This is Dr. Victoria Brooks, reminding you that your vitality is not lost. It's waiting to be reactivated, and it starts with 5 minutes a day.